Hi guys, and welcome back. Really good for you to join us. I hope you remain safe and are keeping well. Lovely day today, weather's amazing. Shame we can't go out. And hope everyone is keeping sane during these crazy times. So I thought perhaps today we could start discussing how to really approach the patient as opposed to just the diagnosis. And in this context, I mean opening up a patient's narrative from their perspective. And this could be in the context of ICE, but ICE, like any other question, is a question that needs to be asked in context. You can't crowbar ICE into any consultation, and I often see this in STs who are having issues with the exam, often looking for agendas that don't really exist. Firstly, don't force ICE, because sometimes it's just there. But the easiest way to open up a patient in the context of whether they are concerned about something is firstly understanding them as a person. And the most holistic perspective and competency in the CSA is competency 14, which is a psychosocial perspective. It's very much the context of how a patient's being affected in terms of their narrative, as opposed to just what you do for work. It's very much whatever they're presenting with, is it bothering them or affecting them in the context of work or outside of work, and how you acknowledge that's really important. There's a tendency when we're nervous not to acknowledge because we don't converse well. So rather than actually acknowledging, we process, and the way in which we process is we go, okay, fine. So doctor, I'm really stressed out about this headache. Okay, fine. It's like, it's not really okay. It's not really fine, as opposed to mirroring. And mirroring is very much I hear you and I see you, I can see it's really affecting you. And then if you're going to ask ICE, really it's very natural at this point to say, had you any thoughts as to actually what was causing this headache, and see what comes back. And in the exam, and indeed in real life actually, it's either going to be, I don't know what's going on, that's why I'm here, I want to get it sorted out. In which case, don't force an E in ICE, because remember, the I and the C come before the E. So if a patient comes to you and says, I don't know what's going on, I want it sorted out, really don't be sort of saying, well, what were you hoping I could do for you today? Because the patient's going to look at you and kind of think, well, goodness me, you're a doctor, aren't you? Not me. But if something does come back and a patient says, well, I'll tell you what I am concerned about, a good friend of mine was having what he thought was migraines, but actually this happened to be a brain tumour in the end, and he passed away quite recently. In real life, I'd never be saying to a patient, so what were you hoping I could do for you today? In real life, I'd be saying, well, I'm sorry to hear that, and I can see why you're concerned, and then I would use that patient's agenda, that concern, to refocus my own thought processes. So if a patient is worried that potentially their headache may be caused by a brain tumour, use that health anxiety to play ping pong. Use it to focus down on red flags. Let me ask you a few additional questions about this headache. Does the headache ever wake you up at night? No, it doesn't. Have you ever noticed it first thing in the morning? I haven't. You ever been sick with a headache? No. Have you had any visual problems at all? No. Have you noticed any weakness to any parts of your body? Your face, arms, legs? No. Any sensory issues like numbness? Pins and needles? No, nothing along those lines. Okay, well, Mr. Smith, that sounds quite reassuring. Obviously, I can see you're concerned about the headache. Tell you what, let me examine you today, and then we'll readdress your agenda. It's so important not to look for hidden agendas. It's so important not to sort of say, so were you hoping I could do an MRI scan then? It's like, well, not really, but now that you've suggested it, sure, I'll have one of those, thank you so much. If agendas surface later on, then it's okay, they can be dealt with later on. But actually, if you don't focus on the I and the C, then actually you'll not really be listening at all. So make sure that you stay close to the patient's narrative and to their agenda, but don't go looking for a hidden agenda. And really hoping that you guys are finding these little podcasts useful, just to keep things ticking over while we wait for things to settle. My own mum, unfortunately, still stuck out on this cruise ship, and really hoping that she can have some stability in what's going to be happening over the next few days. So hopes and prayers with her, and also with your loved ones too, who I'm sure may be going through equally challenging times. Alright guys, keep safe, and catch up with you real soon. Okay, take care for now. Bye.